Thank you, Mr. Chairman. You have in front of you, I think it's preliminary draft 3651. I want to open by saying we are all in some very unfamiliar territory. I don't think anyone would have predicted we would be where we are at today a year and a half ago. These are unprecedented times. I'd also say that we're charting new territory because I think we always try to hinge on what has happened in the past. We try to look at expert testimony. And I'll be honest with you, I don't think there is such a thing right now. We don't have a past to look at when it comes to this topic. We don't have experts in this field. And so I think we have division. Even among the medical community, there's division. Among the business community, there's division. And it has become a very emotionally charged issue. And what I've tried to do with this draft and what we've tried to do with this is address two issues that in the middle of all this have come forth that desire some urgency. I'll talk about those. The first one is I'll call it the Medicaid issue. It was interesting. I was having a conversation with somebody from New Jersey, and they said, we're out of our state of emergency. Why are you still in a state of emergency? And I said, well, there's some things that hinge on that are to the healthcare world and such are important. And one last piece of that was this Medicaid issue. And initially we thought, well, there's a hit, but it's not going to be a huge hit. We can come out of this emergency and be okay. And then we find out the last, just basically days before work day, that's now a hundreds of millions of dollar potential hit. It pushes people off of, 250,000 people off of Medicaid. There needs to be a fix. That requires an urgency that we're here. There are three things within that Medicaid issue I want to touch on. One is the federal dollars that we get to help aid and of those programs, and that's where those hundreds of millions of dollars is at risk, including millions of dollars we'd call back from providers that have already been paid, and it would force people off the program. I always said Indiana's a donor state. We send more to the federal government than comes back to us. And I'll say this, if we want to take some stand and say, well, that's just money we're willing to give up, I guarantee you, California, Illinois, New York, they'll gladly take Indiana Hoosier tax dollar money. The second thing within this is within the SNAP program, under the Federal Families First Coronavirus Response Act, there was language in there that gave additional SNAP dollars to recipients that were eligible. That would end. And I think that is another issue we have to address. These are some of the meals for the most needy among us. Nothing in this bill allows them to make other changes to the program, just simply, again, capturing those that I would say are Hoosier tax dollars that are coming back to us. There's an end date on this piece. This ends on March 31st. It's tied to the feds making their decisions at that end. The third provision within the Medicaid fix is the vaccines. And this has created a lot of controversy among people. And that is allowing those families who choose to have their children vaccinated and are in need of, maybe they don't have a pediatrician, maybe they don't have access to care like a lot of us do. They still would have access to these free clinics that they can go and get the vaccination. The language in the draft is very, very clear that this does not create a mandate or allow a mandate from the state to force the vaccine on any child. And two, it does say that in no way can they waive the parental rights that are currently there that say for a vaccine you have to have a parental acceptance. So I want to be very clear that there's no mandate for that vaccination. The second piece of this is around those vaccine mandates. As you know, the federal government came out and said, the president came out and said, we're going to have this mandate of vaccinations. I think that was immediately responded by the business community and others as, wait a minute, time out. Where's this going to go? We're in the middle of a supply line crisis. We're in the middle of an employment crisis. I can't afford to lose a single employee. Now I'm put in this box. And they began to turn and say, give us some guidance. What are some things we can do? OSHA has some language around exemptions and testing. And so we said, let's follow where the feds go and do something here for Indiana. And what we're really trying to find here is a balance between a business's right to manage their affairs. Every business here, if you're a business owner here, the last thing you come to us for and say is the government needs to be more involved in my business. We want to say businesses have a right to make their decisions. But then we also have an issue of the rights of the individual. I, as an employee, have rights. And those rights are some of the most closely held American rights. And that is my religion and my health. So that balance we have now between the business's right and the individual's right come to what you see in this bill. So this does allow businesses to continue to require a vaccine. That's their right. This also allows an individual to request and be granted an exemption for religious reasons, medical reasons, immunity reasons, and those are their rights. Too many have entered into this debate and want to determine eligibility. I've had businesses tell me, we will decide your religious eligibility. That goes contrary to what federal law has. Title VII of the Civil Rights Act of 1964, the EEOC, several of those state you have a right to your religious conscience. And a business should not be able to challenge that. Second is on the medical. We're trying to draft this very similar to what you see in Title I of the Americans with Disabilities Act and allowing these medical exemptions. So I don't think we're charting new ground. I think we're simply saying what we are putting in or trying to codify in the Indiana Code is what's already there in rule federally. And I've had a lot of businesses say, just give us some guidance. And I know people have said, well, we're coming back in January. It can wait till January. I'm telling you right now, I have people that are saying, I'm on the chopping block. I've worked there for 25 years and I'm about to lose my job. This can't wait till January. I think we need to take this action now. The last thing is there's just a couple of other issues outside those two main pieces. One is nothing in this bill requires an employer to do anything. Right now, we do know the OSHA issue has been stayed in the courts. If none of that takes effect, nothing in here says you have to do something. I've had employers say, you know what, I'm just going to wait and see what the feds do with the whole ruling. I'm not going to put any mandates in place. I'm not going to put any testing in place. This bill says you can do exactly that. You're compelled to do nothing. It also allows employers to say, okay, I'm going to grant you these exemptions, but I am going to require testing. For the safety of you want to have a safety issue, I want to require testing. We say if you want to require testing, you can require testing, but no more than one time a week and at the expense, not at the expense of the employee. If I do all those things as the employee, you can take no adverse action against me. So I can't be fired for doing these things that this bill would allow me to have. And then second is, if I don't take those exemptions, I agree to the testing, and then fail to comply. I'm just not going to do it. You're requiring me to take the test. I'm just not going to do it. I don't want the exemptions. Then you can't take an adverse action. So we do give, again, the power of the employer to have, if we agree to something, you don't do it, I have a right to take action. Another piece of this is we do clarify some language around the vaccine passport. When we passed this bill in the last session, we talked about state and local governments. Then it became an issue with universities. And I think we're just simply clarifying that this does include public education, including state institutions. And to be honest, the ones I've talked to are already compliant with that. They're not making those requests anymore. That's a 30,000-foot view on this bill, and there's a lot of people with opinions and discussion. There'll be a lot of questions. But I want to end with this. As I said when I began, we're in uncharted territory. So for me to stand here and say I'm holding before you the perfect drafted bill to solve the problems, that is in error. This is a good bill, but I think we have to listen to what we hear today and make it a better bill. But I want to tell you, I think we are committed that we're protecting number one, to fix the Medicaid issue, and two, is to protect the individual liberties of the employees. And then the last thing all this is wrapped around is it brings us to the end of our state of emergency, which is it's due time for that. So with that, Mr. Chairman, I'll be happy to answer any questions.